Our immune system is immensely powerful. It runs throughout our entire body, and it touches every single organ within us. And it's important every minute of every day of our lives, from simple things like grabbing the handle on the metro on your way to work, to pushing the button in an elevator to get up to your floor, to get to your office, after you've sat down in your chair, when you start typing your emails and touching your keyboard. Even just sitting and breathing, our immune cells are working to fight off bacteria and viruses, preventing infections from happening and preventing damage to occur to our bodies. Even alone, our immune cells patrol our bodies for cancer, pulling out different cells that might become cancerous or are headed that way and prevent tumors from forming. And that's just when everything's working properly. When things don't work well, our immune system can stop functioning. It can let those bacteria pass. We can have things like immunodeficiency, but we can also have things the other way, and our immune cells can act too strongly and start to damage our own tissues. When we first learn about immunology in our lecture halls as we're sitting with our textbooks, we're taught in the context of infections, viruses, bacteria, fungi, but our immune cells play a really important role and are beyond just our body's defenders. They actually act in things like wound healing, and not just preventing those infections, but healing that tissue, laying down new skin to help heal back what had been damaged. So one question that I've been having for a very long time is that how our body knows not to attack itself during an injury. Your skin is not supposed to be cut open, so how does our body know to heal that back and not accidentally damage itself? Before we are born, our immune cells are trained to recognize our own cells and tissues through a phenomenon known as self-tolerance. Our immune cells are tolerant of our own cells and tissues. And we know that there are different mechanisms by which this keeps itself up into adulthood to make sure that our bodies stay and are working in concert with our immune system. However, there are rare cases in which this self-tolerance breaks. And this can happen due to excessive inflammation from viruses and bacteria. It can also happen due to mutations in our genetics. This leads to that overactivation of the immune system and having cells start to act against our own bodies in a phenomenon known as autoimmunity. And this can damage skin, it can damage nerve, it can damage muscle, it can even lead to death. So why, in an injury where we have dirt, we have bacteria, we have viruses, we have damaged tissue, we have all of this inflammation, why does our body not start to attack itself? Imagine a motorcycle rider out for a ride, hits some loose gravel on the road, falls over and slides. The rider now has an abrasion and a laceration. They survive, but they've got an injury. The second that injury happens, there is a cascade of immune responses that occurs, preventing that bacteria from taking hold into an infection and cleaning up that damaged tissue. Then it goes on to lay down collagen, a scar, to help seal our body away from the outside world. So our laboratory was interested in these different immune cells that were responding to this injury. And we specifically wanted to look at muscle injuries. So when we looked in the laboratory, we found a wide variety of different immune cells responding to an injury, and they all had different roles. But one really stood out to us, and it's called the dendritic cell. Now, why exactly were we interested in these dendritic cells? Importantly, they maintain huge communication with adaptive immune cells. Adaptive immune cells, our T cells and our B cells, form long-lasting immunity, and they also help mediate that self-tolerance. So if we can figure this communication out during an injury, we might start to have targets for therapeutics to help promote wound healing. So let's take a little bit deeper look at these dendritic cells that we find responding to this injury. When we look in the injury and we look at the different types of cells, we find one specific type of dendritic cell that when we treat the wound with a material that helps healing, the number of these cells in the injury skyrockets. However, if we instead treat that injury with a material that causes inflammation and scarring, these cells are nearly wiped out from that injury site. We're not the first people to have described this specific type of dendritic cell. It's been reported previously by researchers that have been looking at cancer. But as far as we are aware, we are the first people to have found it in an injury. Now, why should we care about what happens in cancer? So in cancer, our immune cells are what are called self-reactive. So they're reacting to our own cells and our own proteins, ones that have become malignant, ones that have become cancerous. So what we wanted to know was whether or not these dendritic cells were responding to our cells and injury, but in a way that caused our immune system to calm down and not attack our damaged tissue. So what we decided to look at was the communication between these dendritic cells and an adaptive immune cell called the T cell. Our theory was that these dendritic cells were sending some information to calm down the T cells and say, hey, this is me, please do not attack. So we looked at what would happen if we didn't have this specific type of dendritic cell present. And what we found was we took the brakes off. The T cells kind of freaked out a little bit, and they activated a whole lot. We saw this in the muscle. We also saw it flowing throughout the blood. Furthermore, in addition to just looking at the immune cells, we of course had to know, well, what happens to the muscle? We see differences in our immune cells. What about the injured tissue itself? So let's take a look under the microscope. So if we look at normal, healthy muscle tissue, it looks nice and pink. And then if we look at an injury where we don't have any dendritic cells present, we can see that injury site, but instead of muscle coming back, we wind up seeing fat in the place of muscle. And we also see random muscle fibers that are far from the injury site starting to die. And this is even 3 weeks after an injury happens. So this suggests that these dendritic cells are actually really important for helping heal these injuries and prevent even more damage from occurring. So we know that they're important for helping heal our tissue. How do they get there? If we know how they get there, we can start to target things for therapeutics. When immune cells are responding to a challenge like an infection or an injury, they follow the signal from a protein called chemokines. You can think of chemokines as breadcrumbs. They lead the cells toward that site. And these dendritic cells and these other immune cells follow very specific breadcrumbs, so they know exactly where to go. Unlike me, I will follow any bread. The specific breadcrumb that we were looking at was a protein called XCL1. And the reason why we were interested in this was because if we looked at our dendritic cells, they had a receptor that was very specific for that protein. So we wound up looking at our injured muscle versus healthy muscle. And we saw the second an injury happened, we had an increase of this protein. So we found our breadcrumb. The next thing, after we followed our breadcrumbs, is we need the door. We need the thing that allows those immune cells to come into the injury space. And for that door, we were looking at a protein called E-cadherin. This protein helps cells stick together. And the reason that we were curious specifically about this protein was we saw another protein on our dendritic cell called Sc.D that binds E-cadherin. And so we did exactly what we did with our breadcrumbs. Do we see E-cadherin pop up with an injury? And the answer was yes. In healthy tissue, it's not there. When we have an injury, we see this protein appear. So we have our breadcrumbs, and we have our door. Now what do we do next? Now that we know how these cells are coming in, our laboratory is working on developing new methods to help modulate the immune response to injury and implantation of medical devices. Our goals are to work with the immune system in a synergistic way to help promote healing of our broken bones and tissues and creating new therapeutics to help us heal our injuries. Thank you.